Hello everyone. We are still on antenatal class, and the topic today is about the hermetinase, the routine drugs for pregnant women. When someone is pregnant, the micronutrients are needed more, and some of these micronutrients are not all gotten from the food that we eat. That's why it's being supplemented by some medication. So today I'll just list some medications that if you know you are pregnant and you're not taking, you're not getting it right, you have to come out or see your doctor or see your midwife and be on that hermetinase, no matter how many ways provided you have already confirmed that you are pregnant. You have to do as quickly as possible to get this medication, because you need it for a healthy pregnancy journey, and you need it for good and healthy development and the growth of the baby growing inside you. So some of this medication is number one is folic acid. Folic acid helps a lot, and it's been advised that you start taking this in as early as possible. It's even better like few months before being pregnant. But if peradventure you are not on it, you notice that you are pregnant, start taking it as soon as possible. This folic acid helps in healthy development of the baby, and again it prevents neural defect. Is a problem that can happen to the baby's spine, and again also it helps or it contributes to the proper development of red blood cells. And another medication I want to talk about is ferrous. Ferrous, like it prevents iron deficiency anemia, and iron deficiency anemia is common in pregnancy, and there's much load for that woman, and there are a lot of physical changes that can cause that pregnant woman to be anemic, that is to have low red blood cells circulating in that woman's body. What do? We supplement with medication, and that is ferrous. So with this ferrous sulfate, it helps a lot to boost your red blood cells in the hand, and at the long run, it prevents a pregnant woman from being anemic. And the complication of anemia is not something anybody would like to experience. Another vital supplement is vitamin B complex. Vitamin B complex helps a lot. It makes cells healthy. It also helps for nerve development. It helps for development of the proper development and the growth of the baby that's growing. So it's a micronutrient that helps a lot. It even boosts someone's appetite. The importance of it goes on and on. So I will list some of the components of this vitamin B complex. B contains different vitamins, like about eight. Number one of it, as in, which is the B1, which is can also be called thiamine. B2 is riboflavin. B3 is niacin. B5 is pantothenic acid. B6 is can also call it pyridoxine. B7 is biotin. And also the normal one we know, which is also called B9, that is also folic acid, is a type of vitamin B complex. And the last one there is also called vitamin B12, which is cobalamin. Very, very important. So all these vitamins are micronutrients that you may not get it fully from your diet. That's why it's being supplemented. They will It's being administered to you for a healthy pregnancy and for proper development and the growth of the baby growing. So you don't need to know all these names, just for you to be aware of what you are taking and what you are consuming, and it is necessary. So another thing is vitamin C. Vitamin C is not really like a routine, you have to be taking it when necessary. Maybe you have cough, it can be added to the medication for cough. So it's only when necessary you take your vitamin C. It's not something you take on a regular basis. Now calcium is not is a medication you take immediately you are pregnant. Maybe from 5 or 6 months yes, gestation can consider to take your calcium, or you consider your doctor or your midwife opinions towards that. So these things help. These medications helps in the proper development of the baby, and you also that is carrying this pregnancy to be healthy and to have an uneventful pregnancy journey. So these are the things I just want to quickly drop so that you check your drawer. Are you really taking it? And again, we have different brands that contain all these medications at once. They have all of them. They have all these medications inside one pack. So as you're taking one tablet or as you're taking one capsule, all these things I've mentioned are there in appropriate components. So it depends on whichever one you want to take, the normal routine or the branded one. But the most important thing is make sure you are on one and check your body system and know which one your body tolerates more.